So I'll be talking about handling difficult conversations, which I think is very important when we approach cancer care in general. And not just as physicians, as clinicians. I think it's useful for everyday life when we're supporting family and friends, not necessarily undergoing cancer treatment, but in their everyday struggles as well. It can definitely get better. While there are palliative care specialists in the Philippines, I think there's still a lot more room to grow in terms of recognition and acceptance, whether that's from patients, families, or from specialists themselves. Because even if medical oncologists know about palliative care, I think we can still do better in terms of referring to specialists. I think the common misconception is that as medical oncologists, we already know how to handle difficult conversations. I think what we need to recognize is that it's a skill that we need to practice every day, and that it's not something that we can just dismiss and be done like in a 5 or 10-minute sit down with the patient. It's something that you have to practice every day, and something that you have to do and dedicate time to. So to have an effective conversation when you're talking about difficult topics, you have to recognize that it's not just difficult for you as a clinician, it's doubly difficult for the patient who is undergoing their cancer treatment or who is getting the bad news that you're delivering. So it's definitely a skill to be mastered, but it's not something that's difficult that you have to spend years of training with. You just have to recognize that it's something that you have to learn, and that it's something that you have to practice. I think the most important thing that I want to say is that palliative care is not something that we should think about just at the end of the trajectory of the patient's illness. It's something that we have to recognize that can be helpful even at the beginning of diagnosis. So we can help not just when the patient's treatment ends. We can help when they're just beginning with their treatment in terms of exactly what I'm going to be talking about today, in terms of having difficult conversations and in terms of preparing for the future. My hope is that after today, the clinicians and even the patients and patient advocates would recognize that palliative care is here and that it can help. And as medical oncologists, we can learn to give primary palliative care and learn to handle difficult conversations with our patients.